Mr. Kindra, we are at IRIA 2017 and it is one of the biggest event in the Indian imaging industry. What is the significance of IRIA for Carestream?
I think for Carestream, it's important for us to really showcase what we are, what's our purpose, and what are we going to do in the future. I think that's more important. So we've created a nice booth in IRA at this time, and as you can see, a lot of people are coming in. We are also trying to show them various products, solutions, and the service and the innovation. And there are something which is coming up very soon, and there are something which are potentially disruptive in nature, can change the entire way the future imaging will look like. And that's why the theme of us is future of imaging, as you can see from outside. So we've seen a lot of people who are coming up, and it's also an opportunity for us to engage with them, to talk to them, to understand their requirements, as well as to also show them what we can do for them. So I think that's the significance for IRA for Carestream this year.
So your views on the Indian imaging industry, what is the future of the Indian imaging industry?
We have seen a lot of products now coming up. There's a lot of technology, software. We have seen it in MR, in the CTs. You've seen in CBCT the kind of software we have into 3D extremity system. So I think the technology from the IT side will play a key role rather than the devices side. We will see the emergence of the famous word now AI for radiologists. A lot of artificial intelligence of the software will be basically augmenting the decision making of radiology. So I think the life will become very simple. It's going to be very exciting for everybody, for patients, for radiologists, for all of us. Technology provider will really have to work on the technologies. The radiologist will have to really understand and contribute to that technology, and the patient will have to get benefit out of it. So I think the future of imaging is quite bright from that perspective. There's a long way to go still. So I think we are all quite, in my personal opinion, we're quite excited about to see what's the future of imaging is.
What is the roadmap of Carestream in the year 2017? What can customers expect from Carestream?
I think you can see from the environment here, we're trying to change and transform or let's say reposition our company to more of a future looking, more of innovative, and more of solution provider. So we're trying to understand the problem of customers and trying to work on its solutions. If you enter this booth, you'll see CBCT for extremities. We know there are many issues. Why today the radiologists cannot do a load-bearing exam. So we have created a system so that we can actually do a load-bearing exam with a very low X-ray dosage. So these kind of products. So if you come next, we are going to launch in 2017 a kiosk, which is like an ATM machine, where a patient himself can or herself choose what kind of image they want. They want the image on a printout, they want image on a USB drive, or they want to send this image to their friends or to the doctors. I think that's the kind of concept it is. It's nowhere, nobody has seen it, and this is the first time we're launching in India. And 2017 should see some reality as far as this product is coming to the market. I think it will solve a lot of workflow issues for the hospital, and also the ease of use and the choice of the patients. So there are many things. So imagine that it will increase the productivity of the hospital, remove the inefficiencies, and tell patients more satisfied in terms of when they get their output. So that's what we think. In 2017, we will launch new mobile X-ray now, apart from Revolution, which is very successful. We're also now looking at the value positioning on a value tier segment. We're going to launch the mobile X-ray unit, and we're going to consolidate our existing portfolio. Carestream Vita Flex is very powerful. We're going to consolidate that initiatives. CBCT is already there, and the best product which I feel is going to really help in terms of again workflow is a new PACS system. So in that PACS there are many features. Once you understand that the reporting integrated with the images and the entire ecosystem around IT, I think we have one of the best PACS in the world today. Yeah.
And lastly, Carestream recently received the Best Customer Service Award in Healthcare. What factors have led to for Carestream to get this recognition?
I think first of all, we're very proud of it. This is the first time, or after a very long time, we've won this award. This is the award by ABP News. So they looked at our service. I think the major factor was that we are not only looking at reactive, but we are also looking at preventive, and we have also system for predictive analysis. So if you look at, for example, I just give you an example that we have Vita Flex. It's a small CR system, mostly used in towns and small towns on a smaller scale. It's very important that we are able to give them service, and service is a critical part. So this system is like a self-service. Doctor can give us a call. We understand the problem, and it has only 3 parts. It's called modular system, so you just have to replace 3 parts. So we know which part is required. We send the part immediately. It retrieves next day. A user can themselves replace the part. So just a 3-part system, and the old part comes back to the office. So that's how we are trying to really innovate to enhance the service quality, service delivery in the country. There are many, like we have almost every printer now connected via internet. So we can actually see when is the preventive maintenance due, for example, when it can fail. So we can actually predict and replace the part or send the engineer based on the service model before the part fails. So imagine the kind of productivity. So many things were a part and parcel of it. We had great people. I think we also looked at the skill set of the people. We also managed their trainings in such a way that we are able to add tremendous value to our customer. So I think when you looked at all these things together, or somebody else saw it, the jury saw it, and they found us worthy of this award. So we're very proud of it, and I'm thankful to the team and the service managers who really made it possible. So that's how it is. That's how we won the award.
Thank you so much. Thank you so much.